American mask makers wrote in a letter to the Biden administration Monday that they have 233 million N95s and equivalent respirators in their warehouses, and the capacity to make nearly 300 million respirators each month. A new organization called the American Mask Manufacturers Association took stock of their collective inventory and production capacity in order to show the White House that there are more masks available than they might think. The letter comes as the country's largest domestic mask maker, Prestige Ameritech, received permission from FEMA to export millions of N95s because hospitals aren't buying them. The company can't find international buyers either. The new group of 49 US-based mask makers is calling on hospitals to stop asking healthcare workers to reuse single-use N95s. Many hospitals are reluctant to take on the administrative costs of fitting their workers to a new mask. Instead, many hospitals are reusing respirators, scrubbed with decontamination methods that the FDA authorized on an emergency basis. But some advocates for healthcare workers say this puts their lives at risk.
If it's one reuse, it's still unsafe for both the nurses and the patients. And we need to make sure that even one reuse of a respirator is no longer acceptable.
The American mask makers are also asking CDC to revisit guidelines that reserve respirators for healthcare workers, which keeps them out of the hands of everyday people and limits their use in other high-risk workplaces. In a statement, CDC reiterated that respirators should be reserved for healthcare workers, emphasizing each wearer must be properly fitted to one. Despite the proclamations of many members of Congress last year that the U.S. should shore up domestic manufacturing of personal protective equipment as a national security concern, the market remains largely dominated by companies that import their masks from China. The largest government contracts have gone to these large companies or to emergency decontamination methods authorized by FDA. Some smaller U.S. mask makers say they wish they had been tapped by federal officials to boost production earlier in the pandemic. Kansas-based Entech said it appealed to HHS and FEMA in February and March of 2020 for funding to ramp up production, but never received a reply.